me this way. More. Drop your ear.
Oh, wow. Felt my eyes crossed. I've been trying to get my kid to do that, but he won't do it.
How bad do the migraines really get?
I'll throw up pretty bad. There's times where I'll just go lay down because I just feel like my head is so heavy. It's just painful.
So we have Ray coming from Covina. Ray, I know you're having a lot of neck stuff. He said he wanted to come in here because he wanted to get the Tubio lift done. But tell me what's bothering you, what's hurting you, man, what's bringing you in?
Mainly it's just my neck and the back here, a lot of tension. I tore a meniscus in my knee, so I correct, and it seems like my right lower back starts to hurt more. They don't want to do surgery, so they just want to do pain management, but I didn't want to do that, so they just gave me some stuff for inflammation, and it works, but it's still, it's just not right.
How long ago did you tear the meniscus?
Probably about 3 years ago.
And it still hasn't quite recovered?
No.
Okay.
Yeah.
So next stuff, headaches and migraines, yeah?
Yeah, I do.
Okay. How often are you getting headaches per week?
One headache maybe every other week.
One headache every other week?
Probably,
okay.
At least.
Do they get severe? Because I mean...
Yeah, the migraines do.
The migraines?
When I get a migraine, it's pretty severe.
So how often are you getting the migraines?
At least once a month.
Okay.
Yeah.
So the headaches and the migraines are now coming to, I guess they're really severe. And so in a way, how does it affect your daily life? Because here's the thing, no one comes to see us just because of the pain. It's because something in your body, something in your neck, something in your low back, knee, whatever it might be, is now affecting how your daily life is like. So what have you started to notice where it's limiting you?
It'll be mainly when just try to make it through the end of the day, when you're working. I would drive a lot, we go to Washington, Oregon, Arizona, all over. So it's kind of, it's just more of a pain than anything else, driving with pain or working with pain. So yeah.
And I guess that's a huge thing, right? Because you get to the job site and you want to be fresh. But if you're hurting, you can't be that way, right?
Exactly. Yeah.
All right, so let's do it, man. I mean, I think the biggest thing for you is that we want to get your body better so that you can function better, that you can optimally be better, and so that, in the next 5 years and the next 10 years, you don't succumb to these injuries that have started to happen to you. Right? Now, here's the thing. Whenever we look at somebody's spine, there are a few things that we are looking for. I'm going to show you the x-rays so you understand and you know where we're coming from.
Okay.
There are really two big things. One, if you're looking from me to you, right, straight on like this, we want to see a straightness that goes in your spine that goes up and down this way. The other thing is that when we look at your spine from the side, we want to see 3 different curvatures. So if you're looking this way, we want to see a curvature arcs backwards like this, mid-back like this, and then lower back like that. So you need these curves in your neck, and I want you to remember these. Okay. Your neck should be measured at around 43 degrees, and your lower back should be measured at around 40 degrees. So 43 and 40, that's what we're looking for. So when we look at your x-rays, we're going to measure, and if it's not quite there, that's how we know, okay, this really might be where the headaches are coming from, where the neck pain is coming from, because it's all in just a dysfunction. So just imagine this neck here becomes straight, and a lot of times it does. It causes this chain reaction throughout the rest of the spine, causing more pressure in different areas. When you think about your spine and you think about the joints in your spine, the discs in your spine, really what that is all about a weight-bearing mechanism. So if the weight isn't being carried the right way in your spine, that's when dysfunction is going to happen, and that's when pain is going to happen, and that's what we don't want, right?
Gotcha.
So let me turn this way so you can see. All right, so this is your lower back here, and ideally what we would like to see when we look at your lower back, I'm going to bring up a couple of pictures here. So when you look at a x-ray from front to back, like we were just looking at this way, we want to see a straightness. Can you see that?
Yeah.
And we want to see a straightness, and we want to see this levelness that goes across, like that. So you want this to be straight. So when you look at yours, what do you notice comparatively to you?
Yeah, it's a little curvature.
There's a little bit of a curvature that starts to happen. And then when we look at the lower back from the side, right, this is your lower back from the side, and we look at this and how it's supposed to be here, what do you notice about your curvature compared to a normal one?
Yeah, it's curving quite a bit.
Too much, right? So when we measure this, this is that last bone here, 5, 4, 3, 2, 1. You remember what that number is supposed to be?
43?
40.
40.
You're at a 70. Ooh, right. So 40 degrees or 30 degrees too much. That's why you'll have a lot of this tension in here. That's why this thing felt so good, because it was expanding it again and allowing those muscles and the nerves and really the disc to get more water into there so it could hydrate a lot better and allow your body not to be in as much tension and as much pain.
Good.
Right?
Yeah.
So basically anything that we're doing is we're trying to bring your body back to normal so that your body can actually feel normal again. The next thing, this is your neck here. Okay, and then when we look at your neck from, ideally it should look something more like this. So when you look at the two here, what you notice is the difference.
It looks compressed.
It's very compressed. And the reason why we also know it's compressed is because of this. So like I was saying, your neck and the curves are just like weight-bearing organisms. So when we look at a spine, you see how like there's a yellow line right over here?
Yeah.
To the back where all these bones are. You see how much thicker these bones are in the front?
Yeah.
That's where all the weight's supposed to be. That's why you want a curve, because it places all that weight back there. A lot of times that curve becomes lost like it has with yours, and now the weight shifts from being in the back portion to the front portion now. Over time, that then creates this generation, like level 2 to level 3, and you can see the difference between level 2 and level 3 in the sense where, one, the bones that are square right here behind, in front of this red line are now like, they kind of look jagged, they look sharp, they don't look as good. And then eventually these discs also start to deteriorate as well too. And eventually if you leave level 3, it goes into level 4. And that's what we don't want.
Gotcha.
So when we look at this here, and we look at your neck, you see how square these bones are, right?
Yeah.
Square, what do you notice right down here?
That looks kicked back.
Yeah, well this,
Right?
you see like this point?
Yeah.
So doesn't it kind of look like this point here?
I gotcha. Yeah.
So this is, you have some remnants now of level 3 because of all the pressure that's being placed specifically on this. The reason why it's only on this one and not the rest of it is because your body, your neck, is not taking the weight evenly anymore. So for example, if you're supposed to take 50 pounds of weight throughout, and you have 7 different cervical vertebrae, right? 7 bones in your neck. If it's supposed to take if it's supposed to take evenly, it's supposed to take 10 pounds each, correct?
Yeah.
Right? Right now, since it's straight, instead of it being delineated between 10, 10, 10, 10, and 10, it's more like 5, 5, 5, 5, 30, right? And then 5 again.
Gotcha.
So that's why this is now starting to become degenerated. That's why that disc is starting to close even more so than the other things. And that's why you're starting to have a lot of that pain.
Yeah.
So to fix this, it's not just to adjust you, but it's to actually get this curve back and restore the way that we need to again. And the way that we do that are 3 things. 1, the adjustments. The adjustments are here to restore motion and get you out of that pain. 2, there's a foam block we're going to have you get from us, and all you have to do with this is lay on it every single day for about 15 minutes every day. As you continue to do that, that body will start to return back, the neck will start to return back, and then this will stop degenerating. That is the most important thing from here on out, is that we stop this from degenerating, because if that degenerates and that closes, is it reversible? No. You're done. That's it. All right. So we can't let that happen. All right. And then 3 different stretches, different exercises, in order to let your body get back.
Yeah.
Right?
Is that for bad posturing also? Because
It's huge.
it seems like I've noticed over time I'm starting to,
Yeah,
slump.
and it's probably because that's what your daily life is like, right? What you do on a daily basis is really what your body starts to conform to.
Gotcha.
So that's why even small things as walking backwards at the end of the day when you come back home is a huge thing, so that your body can reset and get this posture back the way that it needs to. If you're in this position for long periods of time and you sit down and your head's moving forward like this and you're driving to Washington, Oregon, and you're sitting like this, that's what's going to kill your neck. So that little block, take it wherever you go with you.
Okay.
Because what it will do is allow you to get that neck and extension back, and you'll be better than your core workers as well too.
Great. All right.
All right. So let's do a few checks on you.
All right.
Let's have you turn your head to the right for me. All right. Is there any pain when you can look this way?
No.
Okay. Look straight and stop to where you start to have to force it, okay? So look to the right.
Right there.
Okay. That's when you start to feel a little something.
Yeah.
So your nose here is about like 70 degrees,
Okay.
maybe 65, and we want to be closer to 90.
All right.
This way. Look to the left. So it's a little worse.
Yeah.
So you're like 60, and we want to be closer to 90 here. Where do you feel the pain when you do that?
When I do that, I feel it kind of on both sides, a little here, but mainly right here in the neck.
Okay.
Yeah.
When you look to the right side, do you still feel that same pain too?
More over here on this side.
More on that side?
Yeah.
Okay. So we're gonna pull on you, okay?
Yep.
So we're doing this because we need to get a lot of tension out. Am I choking you?
No.
Okay. Deep breath in through your nose, out through your nose. That's good. In through your nose, out through your nose. Loosen the neck more. It's still too tight. In and out. Yeah. Wow. Okay.
Yeah. Oh. Turn the lights on. Oh man.
How did that feel?
That was good. Yeah, really good. Oh. I needed that. Yeah, it was good. Really good.
Good.
Oh.
Take your time.
Yeah.
Just allow your body to relax.
Oh man. Yep. All right.
You okay?
Yeah.
Good. Take
No, I'm good.
Yeah?
Yeah.
Good. Let's have you sit up.
All right. Boy, I felt it all the way. Right
All the way
there.
up.
Oh man.
I'm gonna give you a minute to just let it just
Okay.
kind of sink in and let your body just process what the hell just kind of happened.
Yeah. Went dark there for a minute. Okay. Yeah. I'm
Your
good.
eyes too far closed.
Yeah.
All right. Let's get your neck now, yeah?
All right.
And let's have you look straight. Let's have you turn again to the right. Is that easier?
Yeah, it is.
Look to the left. That's way.
Yeah. Yeah.
So we finally got things to loosen up a little bit there.
Yeah.
Actually, we're going to loosen up this mid back first. Let your legs and sit facing that way.
Okay.
Good. Lay all the way back. Let the shoulders relax. Head all the way back there for me. Drop it. Feel that popping already, right? Loosen up more. Let it go, let it go, let it go. All right. You okay? Yeah, sure? Good. I have to hug you. There we go. There you go. That's good. Just pop it all the way down to begin with.
Yeah.
Good. Now, turn your body all the way to that side. Now let's take a look again. Look to the right again. That's even better, right?
Yeah.
Left. So even how this mid-back adjusts and aligns is huge. And I'm gonna climb up on top of you, all right?
All right.
So we're trying to figure out how his body just kind of moves. So he's a neck cracker, I can see, right? How does he know?
Yeah.
It's because you're too loose. Too loose for being in pain. Okay, so this whole right side, when I do this, it doesn't want to bend. You can feel that, right?
Yeah.
So that's where we're going to adjust.
Okay.
One more time here. Open the mouth. Yeah, right there, right? Lean back on my leg. So both his occiput and atlas are kind of just shifted off to this right side.
Okay.
Nice and relaxed here. Lean on my leg. I got you. I do squats. So this one we have to just be nice and easy, but also specific. This is why he came. It was for this. But there's so much tension here, so I want you to relax that more. Do me a favor. Bend with me this way. More. Drop your ear.
Oh, wow. Holy shit.
Yeah, take your time.
Man. That was loud, bro.
Yeah, no,
That's crunchy.
that was huge.
Man.
Any chance, when you were getting the headaches, what side were they coming from?
The right, actually. Yeah.
All right.
Yeah. Oh, that's
It's like
nice.
you knew where they were coming from.
Oh, man. That's great. Wow.
Doing good?
Yeah. Yeah.
Let's take a look again. Look all the way to the right again.
Oh, yeah.
That's like 90%.
Yeah.
90.
Yeah.
Almost there too, right?
Yeah. Dang.
We don't want that neck stuff going on.
No.
So pretty locked up down there, right?
Yeah.
All right. So we're gonna take this here a little bit different on this side though.
Okay.
Because I have to adjust this lower part. And we're doing it this way because I need a little bit more force, a little bit more room. Lean back on my leg again. Let's drop. You can feel that pushing, right? Follow with me this way.
Felt my eyes crossed.
I hope we got that on camera.
Oh my God. Oh man. Wow, that's nice.
That was where a lot of that degeneration was coming from.
Oh my gosh. Let's get rid of that.
Yeah.
Oh, that's good. That's
Take
really
your time,
good.
man. Just let it take it in. I mean, these two adjustments were the biggest reasons why you came in.
Oh man. Yeah, like I said, I've been trying to get my kid to do that, but he won't do it.
Don't do it.
No, we won't.
Don't do it. Don't do it.
I'm joking.
No, I know. I know.
All right. Yeah, I'm good.
And see, I mean, that reaction is pretty genuine. And what I mean by that is like nobody reacts that way if that neck pain or that headache and whatnot has been killing you. Like, how bad has it really been for you?
It just like I said, I can tell my posture's way off, and it's just been. There's times where I'll just go lay down because I just feel like my head is so heavy. It's just painful. It's just painful. So, man, I feel like you knocked it out.
How bad, like, scale from, well, maybe not a scale, but how bad do the migraines really get for you?
It could be to where sometimes I'll throw up, you know? Yeah, pretty bad. Like a 9, 8, 9. Yeah.
That's why you're here.
Yeah.
You're like, I don't want that anymore.
No. It's, it gets pretty intense.
Good, man. Well, I mean, that's not good, but it's good that you're here, and it's good that we are starting to get this addressed. But, like I said, with the adjustments, the blocks, and the exercises afterwards, you're going to be squared.
Just glad I didn't have to fly to Houston, so we're good.
We love Houston. It's so hot there. I think it's like 77 or something like that there today.
Oh, wow.
That's not including humidity, so it's probably like 85.
Oh, wow.
Which honestly, I know it says 85, but it still feels like 95.
Yeah.
Right, Ken? Mm-hmm. Yeah, it sucks. But Ken's moving back next month. Lay on your back. Let's do one more. I think he feels good.
Oh, yeah. I feel light.
So we've adjusted a lot already. So we want to adjust the rest. So lift your head all the way up. Keep it up, and down. Good. Deep breath in. Exhale out. And let it go more. Yeah, I know we felt that one.
That was like a tank compared to the other one. No. Oh, man.
Got a little bit more leverage.
I think I watched about 60 videos, and I was like, all the little tricks you do.
There was no tricks.
That was no trick there, you know.
You were waiting for the trick.
Usually you're like, oh, okay, breathe, just pow. Yeah, that was no trick there.
That's the trick, but there was no trick.
Yeah, that felt good. That felt really good.
Good.
Man.
1, 2, 3 up. There you go.
Oh.
Turn your face that way. You're just flying up, man.
Oh, that's great.
Good. And you look straighter, which is phenomenal.
Oh, yeah, I feel
good.
A lot better.
Look to the right. Beautiful. Left.
No pain.
Let's go. Stand up. And try and touch your toes again.
All right. Uh-oh. Better.
Yeah.
How's the belly?
How's that feel on your back?
I don't feel it. Yeah, I don't feel it. Yeah.
Walk around, see how your knee feels.
Yeah. That's weird. There's no pain.
That's good.
Really?
Because we opened up that muscle in the back, and then we also pulled, and once the pelvis aligns, and it's just all about weight distribution, man.
Man, yeah, because I'm walk on it really carefully, you know, and now there's nothing. Feels straight.
Yeah.
I don't feel like I'm correcting them, you know. Yeah, feels really good.
Good, dude.
Yeah.
Have a seat. What changes are you noticing now compared to when you first walked in besides the knee?
The pain in my shoulder's gone. I don't feel it already, and also in my neck.
Yeah.
Yeah, I just feel stretched out. I feel a lot of relief.
Good.
A lot of relief.
I love it.
Yeah.
Thank you for coming.
Hey, thank you.